now invite to the podium Joanne from the National Breast Cancer Coalition.
Well, I had somebody that promoted me earlier that wanted to know why you all weren't doing what the people did in the world of breast cancer. So what I was asked to talk with you about today is what specifically the National Breast Cancer Coalition did to try to create the system changes that they believed were necessary to end breast cancer. The National Breast Cancer Coalition began in 1991. I have been the privilege of having been a consultant to the National Breast Cancer Coalition from the beginning until now. In addition, my history is I've done a lot of work in women's health and public policy. And I think the National Breast Cancer Coalition is unique in that it, 25 years ago, and so when we think about change and what we need to do now, 25 years ago is a long time, and what the world was like 25 years ago was a long time. I mean, the impetus for the National Breast Cancer Coalition was really the coming of age of this whole new women's health movement and getting more women into trials and more research. At the same time, we saw the activism of the AIDS movement. But in addition, what the National Breast Cancer Coalition had going is that across the country, there were hundreds of groups of women, survivors, who were involved in support groups and education and taking care of women. So they were all organized already throughout the country. And they came together specifically because they wanted to change the system. Specifically because they believed that advocacy was what was going to be necessary. And remarkably, so these are all advocates, they're not all survivors, but the lifeblood of this organization are survivors. But from the very beginning, they understood three things were going to be important. We were going to need more research. Believe it or not, 25 years ago, only $90 million was being spent on breast cancer research. We now know that from our perspective, it's not necessarily the lack of money that we haven't gotten the answer of how to end breast cancer. It's very complicated. We also knew that people needed access to quality, evidence-based health care. This is an advocacy group that from the beginning understood that things had to be based on evidence, not just conventional wisdom or it sounds good. And that they believed as advocates, as survivors, they wanted a seat at the table. They wanted to have influence on this whole question about how you were going to end breast cancer. So they formed an organization called the National Breast Cancer Coalition. It's unique in that it's a representative of organizations. Their board is made up of organizations. So it's not the even normal nonprofit board. But also what they understood from the beginning is that these advocates needed to be trained. I think one of the most unique things that the National Breast Cancer Coalition did was devise a program called Project LEAD. It's a 4-day program in which advocates are trained in how to understand science, how to be participants on peer review panels, et cetera. And of course, it doesn't get you a PhD in biology, but you learn a lot in that 4 days about what's important in terms of statistics and data and all that. That was Project LEAD. In addition, they have an advocacy training session every year in which they bring people to Washington. And we don't just send them up to the Hill with some agenda. They spend 2 days understanding why this underlying agenda is for the goal to end breast cancer. Another key component, I think, of their success is that they have been focused. They've been focused on ending breast cancer. And so when people come to us and say, we'd like you to support this particular device or this particular drug, we look at it very carefully and say, is this really going to end breast cancer? Is it going to make a major step toward ending breast cancer? And if it doesn't, we don't get involved in it. So we're very targeted in what we do and what we don't do. The leadership of the National Breast Cancer Coalition are advocates from across the country. They're volunteers, they're not paid, they work very hard, and we, toward the goal, again, of ending breast cancer. So we stay focused, we're trained, we have good leaders. Those, I think, are some of the key components that have allowed the National Breast Cancer Coalition to make strides. We have significantly increased the amount of money that is spent on breast cancer research. Through the workings with the National Breast Cancer Coalition, we created now the really famous program at the Department of Defense, Breast Cancer Research Program, that the advocates are on all of the peer review panels, and including are on the sort of envisioning panels. And it's really made a difference in terms of the research that gets done, because the advocates are always saying, why is that research important? Yes, it's an interesting intellectual question, but if it's not going to get us toward ending breast cancer, then we don't think it's an important thing. Now, of course, we don't always know what are the right questions to ask and to answer, but that has been really also a really important part of, so we have increased the research. We've continued to struggle with the issues around quality, evidence-based healthcare. You know, we learn a lot, and I can hear just attending your first session, one session, you know, the whole quandary too about evidence comes down and people know what they're supposed to do, but it's not always adopted by people. Some people are doing the old things that don't necessarily are no longer based on evidence. So the National Breast Cancer prods people to make sure that people are getting the sort of quality care that is necessary. So that's the model. I don't know how applicable it is to your particular challenges, which clearly are different, but I was struck as I was listening that in some ways you do know what to do. We don't know how to prevent breast cancer. There's a lot of one-liners out there that says you get a mammogram. The people are still saying get a mammogram and you can prevent breast cancer. Of course, that's not true. You don't prevent breast cancer. And we don't know how to stop breast cancer from metastasizing. You do, at least for some people, not all, know what to do to save that life. How you can, though, motivate and mobilize all of the people, and I think our first speaker had some good ideas about it, how we mobilize the people. But you have a clear message, a much clearer message, frankly, than that the breast cancer movement have of actually how to stop the deaths from breast cancer, which haven't dramatically changed with all the attention and all the money that's spent. 40,000 women are still dying of breast cancer. 25 years ago was 46,000. So that's very slow, incremental process for all the money we've spent. So thank you, and I look forward to the conversation.